My name is Katy Kinderman, Joint Replacement Nurse Navigator here at Holland Hospital. Welcome and thank you for joining our discussion on hip and knee arthritis, pain management strategies, and current treatment options. So we will discuss what's typical of arthritis, how symptoms can be managed, and what options are available for diagnosing and treating the problem. Arthritis is the leading cause of disability in the United States. We see 100 million plus visits to primary care and other ambulatory sites every year. And there are two types of arthritis, degenerative and inflammatory. Degenerative arthritis is the most common type and the form that frequently comes with aging or wear and tear. It can progress at different rates and typically affects the large joints first. Evaluation and basic treatment often starts with a primary care provider. But if significant arthritis or injury is suspected, a referral to orthopedics is often the next step. Inflammatory arthritis, although less common, it is no less debilitating. There are many types of inflammatory arthritis. Treatment may be similar to those used for degenerative arthritis, but may include evaluation and/or management by a rheumatologist. Diagnosis of hip and knee arthritis can often be made quite simply by taking a focused medical history, doing a physical exam of the knee or hip, and a simple standing X-ray of the affected joint. If an inflammatory disease such as rheumatoid arthritis is suspected, some blood tests may be recommended. Rarely is a CT scan or MRI necessary to make this diagnosis. In cases where the exam or X-rays are inconclusive, an injection into the hip or knee with a short-acting local anesthetic may help to clarify if the joint is the source of the symptoms you are experiencing, or if they originate from somewhere else, such as tendinitis or bursitis, nerve irritation, or muscle injury. Here is a picture we see of a normal knee and an arthritic knee. Common symptoms of an arthritic knee include pain and swelling, catching or a locking feeling, audible clicking or cracking, instability, difficulty maneuvering stairs, and possible deformity over time. Comparing now a normal hip and an arthritic hip. Common symptoms of hip arthritis include pain of the groin and pain in the front of the thigh, stiffness, limping, difficulty maneuvering from sitting to standing, in and out of a car, and bending down. So now a diagnosis is made. What can be done about it? There are many treatments to consider, and we will discuss those now. Exercising a stiff and painful joint may sound counterintuitive, but motion is lotion. Keeping the joint moving, the muscles strong can certainly support function, but choosing your activity wisely has value. Activities that are easier on the joints include swimming, low-impact exercise like walking or biking. Excess body weight adds increased stress on our joints. Maintaining a healthy weight or losing weight if needed has numerous benefits. A lifestyle centered around healthy eating and regular exercise can help achieve these goals. Sometimes an assistive device or walking aid may alleviate pain and increase stability. When appropriate, brace wearing or orthotics may be recommended. Localized treatment modalities may include the use of ice or heat on the affected area. The use of electrical stimulation treatment using a TENS unit may work to disrupt pain signals, thereby enhancing the body's ability to minimize pain in specific areas. What we put into our bodies daily affects our overall health. This includes choosing to eat foods that enhance our health and well-being. Focusing on a diet that is high in nutrient-dense, fresh, whole foods has numerous benefits. Particularly for arthritis management, avoid foods that are highly processed, fatty, and sugary, as these foods can promote inflammation in the body. Certain supplements have shown promise in decreasing arthritis symptoms. Always consult your doctor before taking any new herbal or high-dose vitamin. Over-the-counter medications and topicals may help to relieve pain. These include acetaminophen or Tylenol, non-steroidal anti-inflammatory drugs. These would be like aspirin, naproxen, or ibuprofen. Topicals would include a pain reliever such as Bengay or Icy Hot, an anti-inflammatory such as Aspercreme or Voltaren gel, or a pain blocker such as capsaicin cream. Your doctor may recommend a prescription medication. These can include NSAIDs, maybe a higher dose as a pain reliever, but also with that anti-inflammatory action. A topical, like an anti-inflammatory, like diclofenac gel or patch. An anesthetic, like a lidocaine patch. Typically, opioids are a last result, and they are generally not recommended for arthritic pain management. An injection in the affected joint can be done as a diagnostic tool and aid in pain management. Hyaluronic acid is a naturally occurring substance. It's most effective in early arthritis. An injection of cortisone is a potent anti-inflammatory, and this can manage symptoms, but it is not a cure. Using PRP or platelet-rich plasma may reduce pain by using some of your body's own blood properties, but it is unproven for osteoarthritis. Stem cells also show early promise, but also unproven and not covered by insurance. When non-surgical treatments have reached a limit, surgery may be an option. What is the best procedure to address the problem, and when is the time right? Arthroscopic surgery can be used in both the hip and the knee joint to treat some forms of cartilage damage and bone deformities. This is most commonly used in knees. It is important to point out that this procedure is not a cure for arthritis, but that it can be used to relieve certain symptoms. Knee replacement surgery involves removing any cartilage shreds that are left in the knee joint, as well as shaping the ends of the bone to accept replacement parts. The replacement essentially caps the end of the femur, our thigh bone, and the tibia, our shin bone, with a metal component where they come together to form the joint. In addition, a polyethylene liner is used to replace the cartilage removed from between the femur and the tibia. Once this procedure is complete, the real work begins. A partial knee replacement is very similar to the total knee, but the replacement parts only address part of the knee joint, most commonly the medial or inside of the joint. Recovery is very similar, although most people report moving through the steps of recovery more quickly and a more natural feeling knee as more of the soft tissue structures remain intact. This option is not right for everyone. In fact, only 10% of knee replacements are a partial knee replacement. Robotic-assisted surgery is one of the newer techniques used at Holland Hospital to enhance the surgical procedure. It is a tool that supports the surgeon's work to enhance precision placement and less trauma to the surrounding tissue. In turn, this can contribute to a quicker recovery. Hip replacement surgery is similar in its scope, but recovery can be very different. The joint is a ball and socket joint, which means it can move in more directions. This impacts the recovery process as stability and strength of the surrounding muscles and ligaments help to retain the ball in the socket. There are also multiple ways for the surgeon to approach the joint. Your recovery and associated precautions will vary based on the approach used. Once the decision for surgery is made, we embrace a very comprehensive approach to patient education and preparation. Success depends on your commitment to preparation, physical, mental, social, and environmental. Our program, in partnership with your surgeon and your coach, will support you from beginning to end. The hospital stay is an integral part of your recovery. In some cases, people may be safely discharged home the same day. Provided you have prepared well, the majority of your recovery time at home takes about 6 weeks. You will continue to improve in strength and confidence and comfort over the first year. Recovery at home is possible and encouraged. Our team can help you plan and prepare so your recovery goes as smoothly as possible. The first week after surgery is the toughest. For knees, physical therapy will be a challenge, but it is essential for successful outcome. For hips, regular walking and daily exercise at first, as you are able to tolerate. Things to expect later in recovery include still managing pain and swelling, but off of narcotics or opioid pain medication. 80% of recovery will occur in that first 6 weeks. You will increase your strength and confidence in this new joint and start to resume normal activity within any restrictions until about that 4 to 6 week mark, including doing other household activities, driving, and work. You'll work towards individual goals, but joint replacement is a journey. The last 20% of recovery occurs over the next 6 to 12 months. In summary, hip and knee arthritis is common. Many surgical options to try. When surgery is right, Holland Hospital Joint Replacement Center offers patient-focused care. evidence-based treatment protocols to minimize complications, and excellent patient outcomes. Please contact Holland Hospital Joint Replacement Center or local providers for more information. We look forward to serving you.